Hello and welcome. In this episode, we discuss some of the most commonly asked questions about kidney cancer. What are they? How are they different from other type of cancers? Symptoms, risk factors, prevention tips, and many more. Let's welcome Dr. Sachin Arakere Nataraj with over 18 plus years of experience treating urological cancers. He is a specialist performing robotic surgeries and he has also handled renal transplants. Hello, doctor. Welcome.
Thank you.
Doctor, I'm sure this episode is going to be a quick guidebook about kidney cancer. Specifically, if anybody looking for any information about kidney cancer, please go through this episode and watch this episode completely. So let's start with basic. What is kidney cancer?
So before I talk about kidney cancer, let me tell what is kidneys. So kidneys are the main excretory organ of our body. They purify our blood. Okay, so they are present in the back, upper back. We have two kidneys. From kidneys, main function of kidney is to produce urine. Okay, so we have something called ureter, which carries urine from the kidney to the bladder. So any cancer or any tumor arising from the kidney is termed as kidney cancer. Okay. Cancers are something called malignancies. They can be benign, which are not cancerous, malignancies, which are cancerous. So tumors arising from the kidneys are called kidney cancers. So it can be arising from the right kidney or from the left kidneys.
We often hear that kidney cancer is incidental discovery. Why is it so?
Yeah. So say like 2-3 decades back, when we didn't have any imaging like an ultrasound or a CT, people used to come with blood in urine, big bloated tummy, pain. Okay. Then we used to find out there is kidney cancer. With evolution of technologies, with ultrasound CT, what is happening is people are also aware that they should have periodic health check. They get their ultrasound done for some other purpose and we catch kidney tumors. So that's why it's called incidental detected tumors. That's the reason it's been also called as incidentalomas.
Okay.
So its other name for kidney tumors are incidentaloma. Okay. Another name for kidney cancer is called internist tumor. You know intern? Interns are the people, house surgeons.
Okay.
House surgeons are called interns.
Right.
Okay. So interns, they order ultrasound for some other purpose and they detect kidney tumor. That's how small tumors were found out. It's called intern's tumor also. It's also called as a radiologist tumor.
Because the radiologist will
find it out. So it's not found out by urologist. Patient will go to a doctor for a cell checkup or some pain in the abdomen. You might think it is stone. Tumor is found.
You said pain. Now, how does one understand this pain is because of kidney cancer or this is because of the kidney stone?
Pain due to stone is classic. Okay, so it is acute. It comes immediately, and it is colic. We call it as colicky pain. So intermittently comes. It comes, it stops. It comes, it stops. Usually they're associated with vomiting. They'll keep tossing up in the abdomen. It's severe pain. Whereas kidney cancer pain or any pain due to cancer are dull aching pain, mild pain, not severe pain. It's tolerable. Okay, so mild low back. So patient might feel there is some chronic pain. So colicky pain, sudden onset, tossing up in the bed is usually stone pain. Whereas kidney cancer pain is not like that.
What are the warning signs that people almost ignore?
So usually kidney cancer don't come with any warning signs. As I said, this is a incidentally detected lesions. Okay, warning signs we do get when it is in advanced stage. Okay, so people first warning symptoms is blood in urine, which is called hematuria. Even a single episode of hematuria can be due to some malignancies of kidney, ureter or bladder, but most commonly the kidney. Second thing is unexplained pain, not responding to any medications. If it is a muscle catch or a back pain, they usually respond to medications or physiotherapy. If it is not responding to medication, it might be due to one of the cancer related pain. Third thing is any lump, swelling in the flank. We should go see our doctors. It might be due to kidney swelling. Unexplained weight loss and loss of appetite. These are the advanced symptoms of kidney malignancies.
How does lifestyle factors like obesity, lack of exercise or diet, right? How does this contribute to kidney cancer?
But single most important contributory factor is smoking. If somebody is smoking, they should quit smoking. Okay, so quitting smoking for 1 month itself reduces their risk of cancers.
Okay.
Okay, so if they quit smoking for 10 years, it drastically reduces. All the carcinogens are removed immediately from the blood if they quit it. Second thing is obesity. Obesity itself is a risk factor for cancers. So regular exercise, having good diet, like having fruits and vegetables, avoiding meat and processed foods, prevent cancers. Third thing is early detection. So above the age of 40, irrespective of anything, get yourselves ultrasound done once a year. Anything in the abdomen we can detect it. The other thing with kidney cancer is industrial exposure to chemicals. Okay, so these are all chemicals or industrial exposure itself. The smoke which we are getting is from cars, or we have a lot of industries. Even the sewage, even the industry chemicals, they are dumped in the water. Okay, so this water get purified and come, but we don't know how purified it is. So we can get chemicals from water, from air, everything.
A non-smoker also can be at risk.
Absolutely, absolutely. So it's not seen exclusively in smoker, but smoking is one of the risk factors.
Got it.
So if somebody is getting kidney cancer, smoking increases it by 4 folds.
Okay. Let's talk about some myths also, doctor. What is one common myth that you would like to bust with respect to kidney cancer?
If somebody has blood in urine, they think that it is, as I said, they think that it is due to stone, or women, they might think due to
Menstruation.
UTI or menstrual cycle. So not all hematuria or blood in urine is, if somebody has blood in urine, they should immediately go to a doctor. Even if it is in a single episode, they should go to a doctor and see. So don't think that it is self limiting, it will subside down. Second thing is, not all kidney cancers require kidney removal. That's one myth everybody has. If you have any cancer, remove that organ. It's not like that. Okay, so kidney cancer, if it is small tumor, 4 centimeter, 3 centimeter, or 5 centimeter, some people have cancer in a single kidney. They're born with a single kidney. Cancer affects that kidney. So the myth is, not all cancers require kidney removal. We can just remove the kidney and save the kidney. This is one of the commonest myth, important myth. So not all cancers, kidney cancers, require kidney removal. We can just remove that tumor and save the kidney.
Explain a little about robotic surgery. Does robots do the surgery?
No, it's actually robot assisted surgery. Robot will help us in performing surgery. So there are two things. One is patient console. Patient is there. The arms of robot are inside. We are sitting outside and we are managing the robot. So what it gives is 3D magnification. So conventional surgery is 2D. Okay. So with 3D magnification, we can go exactly to a point precisely, cut exactly where we need to cut, suture where we need to suture. Robotic gives us about 10 times magnified vision. So what we are seeing now, if we do see robotically, we see 10 times the vision, magnified vision. And it abolishes tremors. So conventionally, and we get fatigue, our hands tremble. Okay, so it abolishes that. There is no tremor with robot. Okay, and coming to the recovery part, there is less pain. Patient can go home early. No incisions. These are the advantage. Not no incision, small incisions.
Okay. If the cancer has spread, is that treatable?
Yes. So kidney cancer, as I said, nowadays we are detecting early and it's confined to the kidney, and we can preserve the kidney also. So if it has gone beyond that, we do completely remove the kidney. Okay, that stage also is if it come.
It spreads to other organs also inside that, which might not be kidney, but
Yeah, I'm coming to that.
Okay.
So if it is involved the entire kidney, we can't save the kidney. We have to remove it. That itself is sufficient. That itself is a treatment. Suppose it has gone into the blood and into the lungs. So then we don't remove the kidney. So there is something called immunotherapy and targeted therapy, which are available nowadays. With these medicines, every day there is advancement in this. Even stage 4 disease, people say like 5 years ago, if it has spread to kidney or any other part of the body, within the RT survive for 6 months to a year. With this new treatment, people are surviving for more than 5 years, 10 years now.
most of the time, during the conversations with doctors like you, the personal experience matters a lot. Would you like to share any experience of yours which turned out very very positive and that actually increases hope amongst someone who is actually watching this?
So I'll give three example. There was one young male, 26-year-old guy. Okay, so he had come with fullness in his tummy. Okay, so we got his ultrasound done. He had a big tumor, kidney tumor. Okay, and what we do is we get an ultrasound. If we find it tumor, then we do a CT scan. His tumor had gone into the vein, the kidney tumor had gone into the renal vein and the IVC, which are the pipe which carry blood from the kidney. So we were able to remove his kidney, the thrombus and the vein with robotically. So he's just 25 years old. See, I told you it comes after 50 years. He came with advanced, he's educated software engineer, 25 years old. He was not married, got surgery done, got married, he has kids now. The other experience is a solitary kidney. Person was born with single kidney.
Single kidney. Okay.
It had a tumor. Okay, so everybody said that he has to have radical nephrectomy, removal of kidney and a transplant. So we did a partial nephrectomy, and he's alive with single kidney with no recurrence. The third experience is I had a patient who had a transplant because both the kidneys had failed. Had a transplant, kidney tumor came into the transplant kidney.
Okay.
Okay, so we did partial nephrectomy and saved the transplant kidney. So these are three examples. We have many examples like that. So three examples. So with early detection and especially with the robot coming in, anything can be done.
Right. Any diet that you would like to specify, telling that these are the foods that will help? Use these in your daily life.
That goes without saying for everything. For cardiac, to maintain a healthy heart, we will say like have plenty of green leafy vegetables, fruits, avoid meat, avoid processed food.
But meat is protein, no, doctor?
Red meat. So I'm not talking all meat. Red meat is not good. Processed foods. Avoid this. Regular exercise. Reduce your weight. That and stay hydrated. Okay. And if you are hypertensive, control your blood pressures.
Hydration sometimes can be misleading, right? We are told to drink 3 liters, 4 liters of water. Kidneys have to process it so much. Is that recommended? What is the recommended water intake that one should do?
So the recommended water intake is a person has to drink adequate fluid so that you produce about 2.5 to 3 liters of urine in a day.
Okay.
Okay. So it depends on the temperature. If it is hot summer, you are staying in North India, even 5 liters is not sufficient. So you're placed somewhere in Himalayas, so you should, based on the weather, temperature, you should make sure that you produce at least 2.5 to 3 liters of urine in a day. Not drinking 5 liters, 6 liters, 10 liters. The main aim is to produce more urine. It should be around 2.5 3 liters. So it depends on the weather, temperature.
Doctor, we actually celebrate Kidney Day, Kidney Awareness Month to raise awareness about these cancers. What is one message that you would like to pass?
So June is considered as Kidney Cancer Awareness Month. So what I would suggest is early detection is very important. Okay, so early detection can save your kidney, early detection can save your life. As I said, any person, any male or a female, any man or a woman over the age of 40 years, they should get their routine mast health checkup done once a year. Okay, at least an ultrasound. Second is any blood in urine, they should not neglect. Okay, don't self-medicate, don't self-treat, don't go by internet. Okay, so avoid all those things. If you have any issues, go to your doctor, ask them the concerns, get it clarified.
Not to Google.
Not to Google. Yeah. You can Google it, but Google gives plenty of answers. You'll get confused.
Thank you so much, Doctor, for sharing a lot of information and for this quick guidebook type of question answer session that you were part of.
Thank you very much.
Thank you.
Thank you.